Good morning, everyone, and welcome to the first of our State of Health events for the week, as we celebrate the end of an unusual and unprecedented year and reflect on the achievements of our sector and of the VHA working together throughout 2020. My name is Tom Simonson. I'm the CEO of the Victorian Healthcare Association, and to start, I'd like to acknowledge the traditional owners of the many lands on which we're meeting today and pay my respects to elders past, present and emerging. Where I am in Woodend, that's the Dja Dja Wurrung people. I'd also like to welcome our members from across Victoria working in hospitals and community health services and serving on boards from across our state, from every corner of Victoria. If you'd asked us this time last year what our end of year event would look like, it probably would not have been this. We would not have been doing it remotely. We almost certainly would have been doing it in the city and expecting you all to turn up there at 8 o'clock in the morning rather than online. One of the silver linings of this global pandemic, and there have been a few, although it has been a terrible situation, we have learned an awful lot. One of those silver linings has been the ability to bring people together, no matter where in Victoria or in fact the world they live and work. And while there is no doubt we're looking forward to catching up with all of you in person in 2021, and I am very much looking forward to getting out and starting to visit services again, we'll also be continuing to deliver events in this virtual format to make it as easy as possible for people to join the conversation. And we've seen an enormous increase in people, the number of people engaging with our events through this year when they've been virtual, and you've been able to fit it in between meetings and not make that journey into the city. So we're going to continue that as far as we can. As well as hearing from the sector itself, we're delighted to have a number of special guests joining us this morning to reflect on the past 12 months. I'll introduce them shortly, but just to say good morning to Sara James from Best of Both Worlds, Grant McArthur from the Herald Sun, Melissa Sweet from Croakey, and Anna Peeters from Deakin University. Over the next 5 days, we will be reflecting on the healthcare sector and how it's responded to the challenges and opportunities of 2020 and exploring what is needed to prepare for 2021 and beyond. While we're fortunate to have put the first and second waves of COVID behind us, the footprint of the global pandemic has left a firm mark on our health system and on the health of many Victorians. You don't have to look very far to see how this pandemic has changed the way health services are delivered. And this year's budget, which provided a significant amount of funding for health, was also filled with countless lines on COVID-19 funding. As many of you would be aware, we have been gathering lessons and capturing innovations and initiatives that have arisen as a result of the pandemic, and I will shortly be introducing a video which brings these consultation results together. However, it's not only COVID-19 that has left its mark on 2020, but a particularly harrowing bushfire season, which seems like a distant memory to us all now. That brought devastation to the doorsteps of our regional members and also sent people to our emergency departments in our cities with dangerous smoke covering almost the entire state at one point or another. And just when we thought the worst was behind us and people were preparing to get on with the year, the first cases of COVID-19 arrived and the way we deliver services changed forever. And if COVID-19 and devastating bushfires were not enough to contend with, we were also in the midst of 3 royal commissions related to health, with major reforms underway in mental health, disability and aged care. I'm grateful to everyone who has contributed to our work in these areas and for your positive commitment to seeing change happen across the state at a time when you could probably be forgiven for not thinking about reform at all. As well as listening to our reflections, I encourage you to share your stories and your thoughts using the hashtag #StateOfHealth on Twitter, LinkedIn and Facebook. And please add your questions for our speakers to the chat, and we'll endeavour to get answers today or throughout the week. We'll also be unveiling a virtual time capsule for the health sector on Friday, and I invite you to share your photos, videos and stories via the link on our website. As I mentioned, today we'll be sharing some key insights from the COVID-19 consultations we've been conducting over the past 6 months, as well as exploring health headlines and looking at the other challenges of 2020, mainly bushfires. Tomorrow, we'll be exploring health in the community with a conversation with Emma King from the Victorian Council of Social Service and reflections by two of our members. On Wednesday, we'll be hearing from the Ministers for Mental Health and for Disability, Ageing and Carers, and taking a look at some of the key achievements from our sector, which you may have missed over the past 12 months. Thursday, we'll be turning our attention to 2021 and thinking about what we need to take with us. And to get us thinking differently, we'll be having a conversation with changemaker Zioni Walker. And on Friday, we'll be celebrating the sector with a series of activities designed to capture the stories of 2020 and profile the hard work across Victoria, and also hearing from the team behind the Voices of Healthcare project. So before I introduce the video, just a few final reflections from me. Whilst this pandemic could have easily forced the sector to reprioritise their approach to significant reforms underway, it has in fact been the opposite. And through forums such as our mental health sector forums and other consultations, we've continued to see change across the sector. And I want to thank everyone for helping make that change happen. As I said a moment ago, you would have been forgiven for focusing entirely on COVID-19, but people haven't been doing that. They've been focusing on those major reform areas as well, which are critically important as we come out of COVID. The past 12 months have proven the value of our healthcare system time and time again, and given us a unique opportunity to engage with government and other stakeholders to share a light on key issues across the sector. And finally, the level of partnership and collaboration across the sector is beyond any of our expectations. And in my conversations with you over the past 12 months, as well as conversations with healthcare leaders from around the country and around the world, I'm constantly reminded of just how lucky we are to be part of the Victorian healthcare system. As I mentioned, we produced a video which brings together the key themes from our consultations over the past 6 months and highlights the incredible efforts of the healthcare sector in responding to COVID-19. As you watch the video, please consider how the ideas can be applied in your services and what additional lessons we can take away. And please look out for your services in the video as an incredible reminder of the work you've all done.
From July to September 2020, the VHA conducted a statewide consultation with our members on the public health sector's response to COVID-19. Capturing a unique moment in time, the consultation represents the breadth of the Victorian public health sector, from metropolitan, regional and rural hospitals to community health services and specialist health services across the state. Here's what they told us. Victorian health and community health services have contributed to some of the highest testing rates in the country. Since January 2020, over 3.6 million tests have been conducted in fixed and mobile sites all over the state, from busy car parks to going door to door to residential areas, to windswept tents in the rain, rural farm gates and on mountains during ski season. Coordinating this mammoth operation not only involved setting up the testing and screening sites and preparing staff, but it's the result of conscientious planning, foresight and rapid realisation of government directives. Behind the scenes, Health and Community Health Services worked vigorously to establish the frameworks for safe screening, testing and crisis response to become essential care priorities. This involved initiatives and programs such as pandemic crisis plans, infection control procedures, staff upskilling and training, and securing procurement pathways for PPE and vital equipment such as beds and ventilators. At the beginning of the pandemic, the sector was concerned about the provision of personal protective equipment, or PPE. Many services also reported on the increased need for staff training in the correct use of PPE and preparedness, including correct donning and doffing and infection control procedures. The public health sector response to COVID-19 highlights the strong relationship the sector has with their communities, as trusted authorities relied on to disseminate the latest information and mobilise the public to engage in screening and testing procedures, as part of the new normal. Across Victoria, hospitals, community health centres and multi-purpose services prioritised community engagement efforts, leveraging the broad reach of social media and website platforms to engage with local populations and promote testing, staying at home, and the importance of following government directives. COVID-19 has emerged universally as a virus that exacerbates existing inequalities, and the core competencies of community health services have been identified as vital to the COVID-19 response, as they successfully build on established, trusted positions in communities to deliver targeted and tailored grassroots care to Victoria's most vulnerable populations. Community health workers continue to support consumers to navigate through the system in a pandemic by prioritising initiatives that connect with and monitor hard-to-reach populations, such as people with poor internet access, non-English speakers, and those experiencing social and geographical isolation. The unique position of community health services to identify and deliver care to socially and economically disadvantaged people at high risk of contracting the virus was specifically recognised in the Melbourne public housing lockdown response, where community health workers on the ground received positive feedback from the community. The response to COVID-19 has seen the health sector overcome significant challenges and pivot within rapid timeframes to deliver care in new and innovative ways. Some health and community health services have also overcome major barriers such as administrative red tape, funding constraints, and internal cultural resistance to change. Services converted non-essential care from face-to-face to virtual delivery, redeployed parts of the health workforce to maximise efficiencies, and solidified sector-wide partnerships for improved communication, consistency, and integration of infection control and care delivery. This agility has enabled the sector to adapt and embrace more efficient modes of care delivery and virtual operations to meet the needs of Victorians in a crisis. Since March 2020, over 14 million telehealth consultations have been billed to Medicare. Overwhelmingly, telemedicine has become an accepted primary method of care delivery and enabled health services to maintain clinical contact with patients and, in some cases, extend their reach outside their catchment areas to deliver statewide regional support. As a key component of the pandemic response, telemedicine has maintained patient access to healthcare for many people across Victoria. Health providers are supportive of its continued use in a post-pandemic environment as part of a hybrid model alongside face-to-face clinical appointments. Early in the year, most health services overhauled the way their staff conduct their work to expedite flexible working arrangements and direct those who can to work from home. Sections of the workforce who could no longer perform their roles were resourcefully redeployed by agile leadership teams who saw opportunities for employee skill sets and experience to be applied to emerging crisis response work. For some services at the outset, this resulted in greater efficiencies and improved staff satisfaction. Health services reported initial adrenaline-fueled months of high performance and momentum as the pandemic response was actioned across the state. More recently, however, the challenges of delivering healthcare in back-to-back crises from bushfires to COVID-19 has begun to take its toll on public health workers. For some health workers, the strained work environment was exacerbated by the trauma of the aged care response crisis and increased aggression and abuse from consumers and families relating to testing, infection control regulations, and changes to visiting protocols. In some cases, this stress was compounded by increased media shaming. Services faced workforce issues associated with staff furlough and illness, with some leadership teams observing increased rates of leave uptake, such as carers' leave relating to school closures. Most services report that high numbers of employees have worked for months without a substantial break, leading to large amounts of accumulated leave and no backfill capacity to facilitate uptake. Maintaining staffing numbers while complying with infection control measures such as frequent employee testing, isolation requirements following positive cases, and staff outbreak management were also major challenges for some services. Following the second wave of COVID-19 in Victoria, health services are prioritising workforce resilience as they observe increased incidents of staff fatigue and mental health issues. Health services operating in bushfire-prone regions are already contemplating the additional challenges they will face providing care in a pandemic in the lead-up to another bushfire season. Now that restrictions have receded and Victoria enters a recovery phase, public health services are bracing for an increase in physical and mental health presentations previously deferred due to COVID-19. According to some health services, the pandemic has resulted in adverse treatment and care consequences for the delivery of non-COVID healthcare due to government-mandated deferral of treatment and public concern about infection rates in healthcare settings. Beyond elective surgery wait lists, health services reported fewer specialist referrals during lockdown and are now addressing the anticipated increase in demand for social support, family violence and mental health services in addition to deferred non-COVID-19 healthcare. A silver lining of the pandemic has been new and strengthened partnerships and collaboration across the health sector. To address the challenges presented by the pandemic and coordinate an integrated response, many health services continue to rely heavily on one another, leaning on peers for advice and support. Expected overwhelming demand due to the pandemic required health services to adopt a more networked approach to how capacity is planned and shared. This demonstrates the resilience of the health sector to confront even the biggest challenges head-on and emerge with renewed strength and resolve to improve the system for all Victorians.
So I hope you got a sight of one of your services in that video. We certainly tried to include as many of the learnings as possible from across the state, and I'm incredibly grateful to everybody who participated in that. So to continue the focus on what we've learned from the past 12 months, I'm pleased to invite Professor Anna Peeters from Deakin University's Institute for Health Transformation to share some further insights that she's taken from the COVID-19 health sector forums that we ran together. And thank you very much, Anna, for the support you've given to that work.
Thanks very much, Tom. It's a real pleasure to give my reflections today, and I just wanted to thank the VHA and actually the sector more broadly for what's been a real privilege in co-facilitating these VHA forums over the past months. I think one of my main observations is, although the pressures and the stresses have been completely clear and openly communicated, everyone from across the sector has shared their learnings so freely and generously, and I think that puts us in a really good position to go beyond 2020. So across the board, I suppose my observations have been from these forums and beyond that across the health sector, we've definitely identified new challenges through COVID. But as has been alluded to in the video, we also built enabling environments to try things much more quickly than perhaps we might have had permission to previously. But on the downside, I think a number of the cracks that we all already knew were in the system have been further exposed and exacerbated. So I suppose I wanted to highlight three main areas where I think we really need to continue what has become quite high priority action. And they're areas that have been both challenges and I think offer opportunities. So one which came really clearly out from the VHA forums is the expansion of virtual health. We heard a lot about the uptake of telehealth, but as we know, that's about 90% still on the telephone. We've had a few great examples demonstrated around virtual health more broadly and data integration. But I think the question for us now is, how do we really fast track our experiences that have been begun through COVID and share our learning so that we can embed really high quality integrated virtual systems at scale with the capacity to keep adapting. Because I think one of the things we've really learnt is one size doesn't fit all. The model we build today won't be the model we need tomorrow. So that constant adaptation, I think, is key, as is, I think, an eye to equity. So how do we build these systems and make sure that they really are serving all of our community to the best extent possible? My second area where I think we can really build on our learnings is around the integration of health and social care. And again, I think you saw some good highlights of that in the video, and we heard a lot about that during the forums. And I would say that it's the first time that I've really seen politically and publicly such strong acceptance of the connection between our health lives, if you like, and our social and economic lives, and the capacity to really think about how to integrate those. And we heard about a string of demonstration projects. You know, many will be familiar with the co-health model that have emerged during COVID, both at these forums and in the news and the media and through our networks. And I think this is a real chance to think about what might fully integrated care look like, and how can we perhaps build on this to reduce what are essentially avoidable harms and avoidable health inequalities. So my big question in that space, I think, is what's next for the sector. And then the third one that I wanted to end on was also very well highlighted in the video, and I'm sure the panelists are going to talk about it more, and it was on the front page of The Age this morning, and that's the issue of health workforce wellbeing. We heard many times across the forum from the speakers and the panelists about how COVID has further exacerbated the stresses that we already know are experienced by the health workforce, at the same time as it's also brought new ones. And I guess what has stood out to me is it's a real clarion call, if you like, for an integrated response, so that we can both address what we already know are the modifiable root causes of workforce stress, such as working conditions, that still speaks to occupational health and safety, but then really thinks about how we promote health and wellbeing in an ongoing way, embeds these support services, and really facilitates the workforce to provide the care they want and need to in terms of high quality patient care through constant communication. And I think that's, to me, probably the point I'd like to end on. That was one of the resounding things that came through all the forums, is the way that all our services across the health sector have stepped up to think about what embedded, consistent and clear communication looks like, so that everybody can be working with the same set of expectations and rapidly responding to the ever-changing environments that have been thrown up at us. And I think if we do that together, there's significant momentum and openness at the moment for us to build a system that will really support a well, resilient and sustainable health workforce beyond 2020. Thank you.
Thank you, Anna, and thank you for being a part of our health sector forums across 2020, and we look forward to continuing to collaborate with you and your colleagues at the Institute for Health Transformation in 2021. So it's now my pleasure to introduce a very good friend of the VHA and the healthcare sector, Sara James, for a special live episode of her new online show, Best of Both Worlds, which she's been creating during the lockdown. And she will be welcoming Grant McArthur from the Herald Sun and Melissa Sweet from Croakey to share the health headlines of 2020. So over to you, Sara.
Thank you so much, Tom. And it's such a pleasure to be with everyone again. And it's a great opportunity to be part of the special session of the Victorian Healthcare Association State of Health event. It's an important event, and I'm always delighted to be talking about healthcare. You know, while we have all been staying home as a result of COVID and changing our patterns to make sure that we protect our fellow Victorians, our fellow Australians, we've also all been, I think, trying a lot of new things. And for me, it was starting something called Best of Both Worlds. I view that Best of Both Worlds as an opportunity to reach out to people who are the best in their fields and talk to them about how we address, or in some cases solve or respond to, some of the most vexing issues of our day. As a journalist, that's very important to me, and that's what I've done during this pandemic, is to start Best of Both Worlds. And one of the things that I wanted to do as a journalist was to talk to people who are the best in their field when it comes to healthcare. So this is a wonderful opportunity for that. But first, speaking as a journalist, I just wanted to talk about some of the ways in which I think my life has changed, and I'm sure it has for you. One of the people that I interviewed for Best of Both Worlds really got me thinking. His name is Ashish Manglek, and he's at the University of San Francisco, University of California, San Francisco. He's co-invented something called aeronavs. And this is using the way llamas work, using that as a technology. And there are hopes that at some point this could make long haul flights safer by giving us a nasal spray that we could use when we're flying. So I think it's important to remember that while we've all been focused on the vaccine, there are so many other ancillary important scientific investigations and indeed potential breakthroughs that are happening around the world that are going to be part of our world going forward. I've also had the impact of this personally, as have all of you. I'm a mom, so one of our children, our older daughter, came home in March, actually. We brought her home as borders were closing. We wanted to make sure that she was here with us. So she's temporarily suspended her university education. And while we're thrilled to have her back in the house, and she's done a great job during the pandemic, obviously her life has changed and she will be heading back to the United States. And our younger daughter, who attends a special school, we saw the impact of what that's like for families, as all of these infrastructures and schools that we all depend on had to temporarily close, and we all learned how to be at-home teachers. Some of us, in my case, I don't think I was so great at it. So I think even though I already appreciated teachers, I did a lot more after the pandemic. And of course, I've also seen how it's taken a physical and mental toll on all of our health. So we're excited to see some of the things that are coming forward, and to see the vaccine, which I think at the beginning people thought was kind of a moonshot, to see that take shape. And I've had an opportunity through Best of Both Worlds and through my other opportunities as a journalist to really see what some of these scientists have been up against. And one more thing that I would mention, I reported for NBC News for many, many years, and I still have the opportunity to report on occasion for my old gang back in the US. And it was with great pride, actually, that I reported on how well we've done and how hard we worked here in Australia to really work together to get a handle on COVID-19. So that's been something else that I've been focusing on during all of this. But today, for our special episode of Best of Both Worlds, as we look at healthcare, it's my great pleasure to introduce two Australians who are outstanding health journalists and who have followed COVID-19 from the very beginning till now. Melissa Sweet is the founder and managing editor of Croakey. That's an independent, in-depth source about news and healthcare. Melissa has been a health journalist since the 1980s, so this is something she knows intimately. And also Grant McArthur, the Herald Sun's health editor. He's been in that position since 2007. He focuses on policy and regulation research, which has been so important in terms of the pandemic. And also Grant focuses on the inspiring personal stories that are part of this, because there has never been anything that has affected so much of our lives in every single way as this pandemic has, not in our lifetimes. So I'm going to start with you, Melissa, if I can. As a health journalist, can you talk about the kind of integrated way in which this pandemic unfolded, touching on everything?
Apologies, that's a small question to start with. Thank you very much.
No, really easy one. No, but you've covered a lot of health stories. This was a health story that was an economic story, that was an inequality story. I mean, had you ever reported on a story that affected so many different things through Croakey and through your other reporting?
Well, just before I get to that, I'll just like to begin by acknowledging country, to acknowledge that I'm speaking to you from the country of the Malakadi people in southern Lutruwita, Tasmania. So I pay my respect to elders past, present and emerging. And I also pay my respects to all Aboriginal and Torres Strait Islander people watching today, and also my colleagues, and acknowledge your incredible contribution and leadership during this time. I think, you know, the whole health system can learn so much from how the Aboriginal community controlled health sector has responded to COVID. So have I ever covered anything like this before? Well, the truth is that I spend a lot of my time these days more in an editorial coordinating role rather than doing as much writing as I'd like, because we're a team at Croakey, so there's a lot of people involved in the coverage, not only me. And I think back to very early in the pandemic, one of the stories I did write was, imagine if we brought this approach to the climate crisis. You know, here we have politicians proudly taking evidence from experts, wanting to act on evidence, taking public health advice. So do I think this is unique? Not really. I think we're facing a number of global health crises, and, you know, you can't ignore the elephant in the room. You can't ignore that we have an ongoing global health crisis that is affecting everything. And do I think COVID is unique in terms of being an economic story, a housing story, etc.? Not at all. You know, every health story is affecting other policies, and that's why we work the way we do at Croakey. We're a non-profit public interest journalism organisation, and our brief is really to cover the underserved areas of health, of which the determinants of health, social determinants of health, are the big ones, of course. And, you know, really the determinants of health affect all health issues, not only COVID. I think COVID has certainly put the spotlight on that, you know, as we've just heard from Tom and the video, but in some ways, by shining the light, made it more apparent. But it's not a new thing. It's not that, you know, insecure work, inadequate income, poor housing haven't always been health issues. It's just in COVID, they've become health issues for everyone. And I think that's probably what the difference is. You know, we've really developed, it's really brought home that collective view of health. You know, my health depends on the health of the person with the least access to the determinants of health.
Right. I think you're right. I think it's become much broader, and in becoming broader, it's made everybody see it more clearly. And I think it's also intensified some of those fault lines and fissures. Grant, if I can turn to you, I think it feels like in some ways that pandemic has been with us both forever, and that it was just yesterday. When do you first remember reporting on COVID-19?
Mid or late January. I'd actually been away covering bushfires and was in the middle of all of that. Came back, and first thing I was looking at when I stepped back in the office from the fires was coronavirus. Never heard of the word COVID, obviously, or COVID-19 at that point, but yeah, it was kind of out of the frying pan into the fire, almost literally, I suppose. But yeah, it kicked off. Initially, it was quite weird, because there was this sense of something overseas, and will it happen here? And you're probably thinking it won't. In the whole way news cycle works, you assume something's going to be huge, and you think it will, but it doesn't quite get there. And I remember having a few very early briefings with the chief health officer and so on, and I was quite excited. I came back to the office and I'm writing up these big stories that are running absolutely nowhere. Yeah, then it took off. Obviously, I remember having a few of those what if conversations. What if it happens? What would be the steps? And it got to the point of, you know, hypothetically speaking, we might have to shut the city down. And you know, nobody thought that would happen, and we wrote it, and it sounded like science fiction. It was only a few weeks later and we were doing it, and it's, you know, it's kind of hard to believe. I get that there's a lot of things impact people's lives and have these impacts individually on some people's lives, but this has had all of these impacts on everybody's lives, and it's been somewhat all-consuming, I'd suggest.
And, you know, one of the aspects that I know that you try to focus on, and I'm sure, Melissa, you do this as well, but Grant, just to you for a moment, when you have such an enormous issue to cover, bringing it down to the human scale, allowing us to focus on one individual so that through that individual, we're able to see the impact. you did some stories on frontline workers. Can you give us a headline and tell us a story that was particularly meaningful to you?
Yeah, I can. I did a few and it was hard. I'll just preface this by saying, I think you're right. I think that is perhaps one of the most important things in the media's role in this, is breaking this down to the human level. When you have so much to cut through, there's so much policy, there's so much arguing with people. I mean, you have some fringe elements claiming all sorts of things that makes it so much more important to show the human face, to show who it is affecting, that this is real and this can be you. But with COVID, that's particularly hard because the people who are suffering the most are distant to us. They're off in a quarantine room, or worse, they're in a hospital situation where their loved ones can't even visit them. So being able to show what the consequences of this, you can show the economic impacts. You can show people getting frustrated and all of those things. What you can't show very easily is why. And I was bloody lucky, and, you know, I'll go to my grave being thankful for people showing trust, but I was able to get into some of the COVID units and spend some time in there. I say I was thankful. I probably won't ever forget what it was like in there. But I mean, you going through some of those units, and you are like, I spent some time in the Royal Melbourne COVID unit. I was in there a couple of times, once in the first wave, once in the second wave. There was a huge difference between the two, and some time in the intensive care unit. It's hard to say. I mean, the impact on the patients, there were patients passing away while we were in there, and there's staff doing video calls with loved ones. And it's hard because you're walking past one room and you can see that going on, and then you're going into the next room and chatting to a patient, trying to forget what was going on in the room previous. Every staff member you start talking to, and we were very fortunate when we were doing this in that we didn't even have an escort from the hospital. It was too dangerous for the PR people to go in there. So it was a photographer and I with the medical and nursing staff only. But every nurse in particular that we'd speak to would only get up 2 or 3 minutes into the conversation, and they would be in tears and bawling, which was hard because everything fogs up and so on. But the strain on them, and you'd see these nurses and they'd be absolutely in tears in the corridor talking to you. Then they'd put a smile on their face and wander in and start treating a patient and trying to be as upbeat as they can. It's inspiring but gut-wrenching at the same time. But I think that's some of the most important things we did, and that's kind of what our job was there. As much as passing on information, it's trying to reinforce that human aspect so people can't turn their back on it and say, this is just economics. This isn't just, this isn't financial. This isn't just an inconvenience in my life. We're actually doing this for a reason. I think people need to be reminded of that so they can persevere and not get us, in a worse situation that you see overseas.
Indeed, you certainly do. I mean, the difference between Australia and the United States and Europe is and other countries as well is really quite stark. Melissa, if I can come back to you, I mean, it's been incredibly important in your work and reading some of your stories. You've really focused on a whole different kinds of communities that have been dealing with this, and some of the ways in which the inequalities that already exist have been amplified or have been highlighted during the course of this pandemic. One story of yours that I thought was really a great story was when you talked about we have lost not one elder, talking about Aboriginal community success in dealing with the COVID-19 pandemic. And I think one aspect of this is it's not just on healthcare, it's on communities, and there were some communities who did so well. Can you talk about that, Melissa?
Yes, thank you. And could I just flick back quickly to something Grant said as well, talking about the importance of journalism in bearing witness. And, I think that is such an important role. And I'm just detouring briefly. One thing we need to be aware of is the impact of the pandemic on the media industry and public interest journalism, and our capacity to bear witness during this pandemic has been, greatly affected. And it's terrific to bear witness in hospital, but there are all sorts of places we haven't been able to bear witness during this pandemic. And I particularly think of prisons and also people in detention, asylum seeker detention. They're incredibly vulnerable populations, and I don't think you know, we've done a good job of bearing witness to them for a whole variety of reasons. But coming back to the Aboriginal and Community Controlled Health Organisation, that story that you kindly put up was from Pat Turner, the CEO of NACCHO, recently receiving the Sachs Medal from the AWHA. So that was terrific that we had the opportunity to publish her presentation, reminding us of the long and proud history of the Aboriginal Community Controlled Health sector. And really, if you know the history of that sector, it began in response to racism in the mainstream sector, that Aboriginal and Torres Strait Islander people couldn't get safe or quality care from mainstream health services, and so developed their own community based services, which, you know, now there is a network and really came to the fore during the pandemic. And I think we hear a lot about hospitals in times of health crises, but this is really reminding us of the importance of holistic primary health care, not least because it addresses some of those wider determinants of health, transport, housing, etc. And also, I think really importantly, and I think this, you know, we're patting ourselves on the back a lot in Australia at the moment, but, you know, we've got a lot to learn as well. And I think communications is one of those areas. And I think, you know, the ACCHO sector, being connected to communities, being able to communicate appropriately to communities, and communications is always not a one-way process, you know, being able to listen and take on communities' knowledge and expertise as well. So we've published a number of stories now, you know, from different perspectives relating to the ACCHO history during the pandemic. And I think, you know, everyone is very pleased at how well things have gone, but there's no room for complacency either. I mean, I just saw the headline this morning from South Korea, you know, big increase in cases there. So I do worry about that in Australia, that we, you know, we don't want to be prematurely complacent, and, you know, the risks are still there, obviously. And
if I can jump in there, Melissa, yes, the risks are absolutely still there, but what is your take on how and why Australia has been able to do a better job than many other countries in terms of responding, in terms of, well, I mean, this is the fashion statement of 2020, wearing a mask. We did. What do you think it took to get that message across through the health system when other countries were really struggling, including my beloved US, to really have buy-in on such an important health initiative and simple?
Well, I don't think we've had buy-in necessarily all the way along, you know, on mask wearing. That's come more recently. Obviously, Victoria is a different situation, but I flew for the first time in October to Queensland in two planes, absolutely packed, not a spare seat, and no one wearing a mask, and the air stewards not wearing them and sort of undermining them as well. So I don't think there's any room for complacency around some of that public health messaging. Why Australia's done better, I mean, I'm sure there's going to be any number of books and journal articles written on this in depth, but, you know, I think some of it has to be a bit of luck, our geography, closing borders quickly, having that national response. I mean, you're in the state that spoke up very strongly for hard and fast action. So, you know, I really commend the Victorian response in many ways. And, you know, as someone who's not living in Victoria but has many friends and colleagues there, I'm really grateful to you all. I think you took a bullet really for the rest of Australia in many ways. So thank you for that.
Thank you, Melissa. And if I can go back to you, Grant, because you've been covering everything as it has unfolded in Victoria. And, you know, there have been struggles. It hasn't been easy. Everybody has really had to rise to the occasion. What was the hardest story that you had to do, Grant, over the course of the last year?
It's been hard for various reasons. I guess I'd break it into two categories. One is emotionally hard and draining, and it's hard actually hearing somebody who isn't from Victoria. I think our perception is so different to everybody else's. When you talk about buy-in, it's unfathomable to me to think that the rest of Australia hasn't been like we have, because you step outside the door and you don't see people without a mask. Like and it would be unthought of to not do it. you might see a couple of people
exactly.
here and there.
This is
But
always with us, always with us.
I can't fathom what it's like for that not to be the case, and the buy-in has been astounding. I guess the emotional part, I know I've the story that was up before, and I did another on a very young girl, only 26, who only just made it through intensive care. She spent weeks in there and had a lot of trouble, but at the same time, her father was in a different intensive care unit and he didn't come out through it. So they went in together with COVID. They were from a migrant family, and the mother had to keep working in a place that didn't do what they should do, in a meatworks. She brought it home. The family got sick. Father, who's quite elderly, ends up in one intensive care unit. Daughter ends up in another. Daughter comes out, but she still has ongoing health issues. Father doesn't make it. Mum feels terrible because essentially she brought the condition into the house, and the results are pretty bad. Half the workers at that place went down. I mean, that's pretty hard, and that's also pretty typical of what happened. That's in the early days. Those ones are pretty hard to work on. But then, even from a purely journalistic point of view, there was a lot of troubles early on. I spent a lot of time embedded initially with the contact tracing unit during the first phase of the pandemic. And I've been on the round a long time. I know a lot of the contact tracers, a lot of the public health teams. So I was able to become embedded with them and spend some time and using that as an exercise to show the community what contact tracing is. And it was almost like a trust winning exercise for the community, as in this is what contact tracing is. This is how it's going to save you. Great idea. And it was a pleasure to do it. I got to learn a lot. Fantastic access. Journalistically, got some great stories out of it on different clusters and so on. That was great, but it became much more important later on because contact tracing started falling down, and it was very hard. I felt like I was yelling into the wind there for a while because we were saying contact tracing was failing, and I had very good sources on it, but we weren't really being listened to, and the numbers were getting higher and higher, and then it just kept coming out that is actually what was happening, but it was being denied. Now, I don't want to sit here and bash our state government either, because they have done a phenomenal job. This isn't about picking on governments, because I think, and that's one of the hard parts of this, is when you're calling something out in a pandemic. I'm very conscious of things becoming political when they don't need to be, because when you're dealing with a pandemic and there's 100 decisions to make, if you get 99 of them right, it's an outstanding effort. The problem is when you get one thing wrong in a pandemic, the consequences can be huge. It can be like running through a stop sign. Most of the time you go through a stop sign, there isn't going to be a consequence. If you get unlucky, it can be an absolute disaster. And I think part of that happened with contact tracing, part of that happened with the hotel quarantine. And for me, those things public health shouldn't be political like that. And that got rolling, and it got on quite a roll, and it got quite ugly here politically. Fortunately, everyone stayed on track, and the faith wasn't lost in the community, and people kept towing the line, and we got through it. But it was very hard trying to cover it, getting the public health message out why two sides of politics were tearing each other apart, and the community's kind of in the middle, trying to keep following the rules at the same time, and that made life very hard, where you're trying to report what's going on in the public interest, but at the same time, you've got both sides of the equation kind of really viciously tearing you apart or tearing the other side apart, and you've got to get the message out in the middle. It's
that is an amazing
point.
That is such a good point. That is such a good point. We're going to need to wrap, but just very, very quickly, 30 seconds each. Melissa, you first, and then you, Grant. The vaccine. Are you optimistic, Melissa? What are your thoughts as we're heading into the rollout of that soon?
I wouldn't say I have any particular expertise. I haven't covered the vaccine myself, although we've published quite a lot. I just would say, after many years of health reporting, I think the thing you learn whenever there's a new treatment, whatever, things often, over time, things often become more complicated or complex. So I'm very much a wait and see sort of person.
You're a journalist. You're going to follow what happens. Let me go to you, Grant. Thoughts
I'm an
on
optimist as well as a journalist, I guess. But no, I'm confident, and my confidence is perhaps more long term. I'm confident that this will be great, but I'm also aware that this is the first, and there'll be more come online as we go, vaccines and other things. I see this as an initial step, a very good one, but perhaps not the last step and not the last vaccine. But I think over time, we are going to be very well looked after. It's a matter of having that public confidence in it as we go. The better the public confidence in it, the better the outcome's going to be, quite frankly.
All right, listen, it has been a fascinating conversation. There's been so much to think about, and the human toll really strikes home, which is why I'm going to hang with cautious optimism and firm, careful, clear reporting, as we've seen from both Melissa Sweet and Grant McArthur. Thank you both for joining us on this edition of Best of Both Worlds for this organization. Thank you both.
Thank you.
Tom?
Thank you, Sarah, and thank you to Grant and Melissa for providing your unique perspectives. And of course, for your coverage across this, hopefully once in a lifetime health event. It's been incredibly important for all of us in the health system to have those messages constantly reinforced about what's going on, just how hard it is for everybody dealing with the pandemic, managing the pandemic. And I for one, and I know our members are incredibly grateful for that reporting, because it allowed light to be shone on some things that otherwise would not have been known about. So we now have a special message from our principal partners, Aware Super.
Words cannot easily express how proud we are of you and your teams, and in fact the whole health sector in Australia, for the way that they organised themselves and faced into the challenges of the last 9 months. And like you, we're sure that they may not quite be over, but the efforts so far have been so impressive. My name is Sarah Foreman, and I'm the Group Executive for Financial Advice at Aware Super. And on behalf of our whole team, we would like to say a very big thank you to you and your organisations for the incredible support you've given all of the teams in Victoria, and for the massive contribution they have made to looking after our communities. I think through these times as leaders, our role is to support our teams, give them the direction they need, ensure that they're safe to fulfill their role, and try and put a little bit of normality in what may have been a rather crazy time. And I know we prepare for circumstances like this, but when they arise, they certainly feel very challenging. The human commitment that you and your teams have made, the hours that they have worked, is incredibly impressive, and such levels of giving are not comparable across many other industries. And as I say, we truly thank you. At Aware Super, we'd like to think that we're here to try and provide that little bit of help and guidance and support to all of your teams, as they may at times be thinking of that time when they can step back, relax a little bit more, even in their futures, step back and work a little less. And that's really when they look into retirement. And it's our job to help support them with whatever education they need, answer any questions they may have, and help guide them to have that best future in retirement. So we're proud to be associated with yourselves. And as we watch how you've worked, we, as I say, are just so incredibly impressed. And we say a huge thank you.
Thanks, Sarah. I agree. What a year. I'm Prashant Iyer, Senior Employer Engagement Manager. I'm incredibly privileged to work with your teams across Victoria, and whilst there has been some significant highs and lows throughout the year, one thing that I have admired is the resilience and the positivity that your staff have had and continue to have. Although 2020 has been one of the most challenging years so far for me, notwithstanding being an employer, and what has become incredibly clear is your desire to support your staff and do what you can to support the health and well-being of those that come to work each and every day. This year, Aware Super, with the support of VHA, has been pleased to introduce our own employer workplace wellbeing programs. I thank so many of you on the line today for embracing this program and valuing it as an important part of your support to ensure your employees are productive, feel valued, and can access resources they need to develop both their financial and professional futures. We have learned employers, just like yourself, play a role in helping their employees cope with financial related issues, providing a safe environment to open up and seek help. And we know that education is the key to creating a more empowered workforce that feels like they have more control and choice in retirement. So we look forward to seeing you and many of your staff join us for our 2021 Workplace Wellbeing Series, which will host a range of new topics for everyone to consider. And lastly, as the holiday season is upon us, on behalf of everyone at Aware Super, wishing you and your loved ones have a safe and a beautiful Christmas and a happy new year.
Thank you to Aware Super for that video and for your ongoing support. Now, from COVID to another challenge in 2020, we wanted to take a moment to consider the challenges that bushfires present to our health services, particularly after the devastating bushfire season that Victoria saw earlier this year, and the fact that we're already in bushfire season again, if you can believe it. And I'm delighted to introduce a conversation with Margaret McDonald, who's the CEO of Cobaw Community Health, who shares some insights into the long-term impacts on the community and the health service, and the added anxiety that this time of year brings to health services and their communities.
Cobaw Community Health is one of the smallest community healths in Victoria with a really proud history. We've been operating for almost 35 years. We are based in the Macedon Ranges Shire in central Victoria. We are not strangers to responding to bushfires across our history. In fact, Cobaw was established by the County Welfare Committee following the Ash Wednesday fires of 1983. Because we've got that history, there's an awareness that fire and bushfires are a constant present. It might have been 2014 or 2015. We had just an exceptionally long summer, and it was a hot summer, and there were repeated bushfires and grass fires. When it got to February and the fire alarms and the alerts were continuing, there was a level of exhaustion in staff. Like, how long is this going to continue? But we know with every summer it passes. For staff, making sure that they are well supported and debriefed is critical. And then the other thing for our clients, some of our clients will wear some of that trauma where they've lost homes and lost property and lost animals. That takes so long for some people to work through the trauma of that. Before summer every year, every staff member is required to update their bushfire plan for the summer period. We review, as the department requires us, our local response plan. We've got staff members that, as young children, lived through the Ash Wednesday fires. We've got staff members that are CFA volunteers. There's been a level of adrenaline that's been in the health sector throughout the year now, for over a year. But staff are incredibly resilient and responsive. Our first emergency management meeting internally was held on Friday the 13th of March, and on the Monday we started moving staff to working from home. Staff were so responsive. They understood the need to get themselves to a position where they were safe so that they could continue to deliver services. Within a week, we had a community connections register happening. We identified immediately that there were some people in our community that couldn't get some basic items. And over the following 6 months, we responded to, just in our small community and just amongst our clients, over 800 calls for a whole range of things. What our clients are telling us, as they are slowly coming back to face-to-face services, they are so pleased to be back engaged. You know, we're in a human service industry which relies on that human contact. In 2017, we were funded by the Regional Health Infrastructure Fund of the Department of Health and Human Services to construct a new site in Kyneton. So we proceeded with that build, and it was scheduled to be finished for practical completion on the 16th of April. And when the pandemic arose in March, we wondered whether we'd ever get that building finished, but it was finished one day late. So it was finished on the 17th of April, not 16th. Our commissioning was slowed down, but we did shift into that building in the middle of March. Staff have had another adaptation and another change, and I just acknowledge how staff have adapted. And I think this is absolutely symbolic of what health services staff do. One of the greatest joys of my time of working in community health is that we work closely as partners and collaborate with so many other people. And I think the other thing that we have learnt this year is, and we've always known it, but it's been reinforced, is partners and collaboration are absolutely critical. And I just want to acknowledge everyone that we have worked with, whether it's been other community health services, whether it's been our specialist services like our specialist family violence service, whether it's been other agencies that we've had long-term partnerships with, the local council. That is the other thing that we have learned through 2020, that our relationships and how we work together is critical.
And my thanks go to Margaret and everybody at Cobaw for sharing those insights and giving us a picture of the long-term impacts of bushfires on health services and the community. And just to give you a little bit of context, I live in the same area as Cobaw Community Health, and our fire danger period, when you can no longer burn off, starts today. So unfortunately, we're back in bushfire season again. Thank you to everyone for joining us today. We'll be posting the videos of this event online from 11 a.m. and I encourage you to share them with your colleagues. Please join us again tomorrow at the same time with the same Zoom link for our conversation with Emma King, who's the CEO of VCOS, and a range of sessions exploring health in the community. And don't forget, you can continue the conversation on Twitter, LinkedIn and Facebook with the hashtag State of Health. Thanks to Sara James, thanks to Grant McArthur, thanks to Melissa Sweet, thanks to Margaret McDonald, thanks to Anna Peeters. Thank you to all of you. Have a great day and we'll see you again soon. Thanks.